Hey guys, it's Dr. Nepute here. I wanted to go over something with you that's very important that you all understand, and that's the phases of degeneration which correlate with the type of care that you need. So I like to use analogies when patients come in the office, and I think people understand dental terms better than anything else because most people are unfamiliar with the spine until we expose them to it. So I'm going to use some dental analogies when I'm explaining the phase of degeneration and correlate it with different types of care. Okay? So check this out. This is right out of a textbook, right out of a medical textbook. So this first one up here is called normal, all right? We all want to be normal, right? So the normal cervical spine has a nice big banana curve to it. So front, back, top, bottom. It's got a beautiful curve, anywhere between 40 to 45 degrees, beautiful angles, nice spaces in the bones, life is good. As a matter of fact, this was taken, an x-ray was taken of a 79-year-old woman who had been getting regular corrective chiropractic care since her 50s, okay? So age is not an excuse. This is called phase 1. In phase 1, you can see it's a loss of the curvature. It's straighter. They've lost that banana curve. When you get phase 1 degeneration, that's like having a cavity. So when you have a cavity, does a cavity develop overnight or does it take time? Well, the answer is it takes some time, weeks to months to develop. So phase 1 degeneration can cause things like, can be caused by physical trauma, emotional trauma, or chemical stresses. It's going to cause inflammation, which can cause pain, so neck pain, back pain, elbow pain, any kind of pain can be caused by this. But the problem is we start to get scarring and adhesion, so it starts to tighten down. Well, when you go to the dentist and get your cavity filled, that's a pretty relatively quick fix. Phase 1 degeneration, since it's minimal decay, it takes about 3 months to 9 months depending upon the severity of the case. I find more kids with this than adults. Usually when adults come to us, they let the cavity sit for too long, and guess what happens? Now the root starts to rot out, and we call that phase 2 degeneration. Phase 2 is when the spaces between the bones, called the disc spaces, start to compress. Well, when they start to compress, we start to get arthritis. So if anyone's been told they have arthritis in their spine, they're at phase 2 degeneration. All right? They start to develop bone spurs, and permanent disc degeneration and decay sets in. So that means it's getting worse daily. It's getting unstable. These are the people that they bend over, tie their shoe, and their back goes out. That's not normal. That means it needs to be fixed. So if you go to the dentist and the dentist says you need a root canal, that obviously is more invasive, takes more time, costs more money, the whole 9 yards. So phase 2 in a kid could take up to 4 months, and yes, we see it in children, and in an adult could take up to 12 to 18 months to get total resolution, normality of the curve, reduction of the pain, everything back to normal. So phase 1 and phase 2 are correctable. If we let this thing sit and goes to phase 3 or phase 4, at that point, there's nothing we can do to help fix it. We can help manage the pain naturally, help you live a more productive and quality of life, but we're never going to fix the problem. All right, phase 3, it says right here, we start to get fusion, severe arthritis, massive bone spurs and decay, severe nerve interference, causes very poor health function, and the nerve begins to fail, starts to shut down. All right, if we get to phase 4, this is complete nerve death. There's no correction possible. This is lifetime supportive care, and if you look here, it says this is a picture of a 43-year-old woman who neglected her body. So 43 looks horrible, 79 looks great. So just because people say, I'm such and such age, that's not an excuse for your health. I've got kids that come in here that are sick as dogs, and I've got people that are 90 that are healthy as a horse. It just depends on what you choose to do. It's not your genetics that choose that. You see? So I want to make sure that you all understand the phases of degeneration. This is a very important part. So on your next doctor visit, whether it's with me or your other doctor, you need to ask the question, what phase of degeneration is my spine in? And if someone says that you just have arthritis, well, ladies and gentlemen, that means you just have phase 2. And if you go to phase 3, it's not fixed. So if you've ever heard you have arthritis or degeneration, it needs to be addressed. The reason why the doctors that you're talking to aren't addressing them is quite frankly because they don't understand how to take care of it. And that's not a bash on them. I don't do brain surgery, okay? But I fix this stuff. We do it all the time. So on your next visit, make sure you understand what phase of degeneration you're in, your kids are in, and your spouse is in. I look forward to seeing you on your next visit. Have a great rest of the day. Take care.